Eosinophilic Granuloma Vertebra Plana. Vertebra plana is a flattened vertebra in the spine, and it is associated with eosinophilic granuloma. Eosinophilic granuloma is a tumor-like condition due to proliferation of the histiocytes. It's called histiocytosis X or Langerhans cell histiocytosis. Eosinophilic granuloma can occur in any bone in the skeleton. It can occur also in the skin and the skull. It also has a visceral involvement. It is called the great imitator. It looks similar to many lesions such as osteomyelitis, Ewing's, leukemia, lymphoma, and fibrous dysplasia. The condition is common in the spine, and it may cause flattening of the vertebra called Vertebra Plana. It has many names: pancake vertebra, coin-on-edge vertebra. The vertebral body loses its height anteriorly and posteriorly, and it is most common in the thoracic spine. That complete compression of the vertebra can lead to back pain or neck pain and kyphosis. If it occurs in the elderly, usually it is due to osteoporosis. But if it occurs in the young, usually between 2 to 10 years old, then it is due to eosinophilic granuloma. It is usually a single vertebra that's affected. Collapse of multiple vertebrae look for other reasons, such as lymphoma, Gaucher disease, mucopolysaccharides, and metastatic disease. When eosinophilic granuloma is seen in bones, it usually appears as a focal destruction of bone and usually seen in children under the age of 10. The lesion may appear very aggressive, however, it is benign, self-limited, and it will heal spontaneously. It affects the vertebral body more than the posterior elements of the spine. Biopsy is usually not needed, especially if the patient has the characteristic history and the X-ray appearance. The disc height is maintained and no involvement of the posterior element. How about the histology? You will have large cells. The histiocytes have a clear cytoplasm and single large oval nucleus or bean-shaped nuclei. These cells does not have nuclear atypia or nuclear mitosis, so it is not malignant cells. And this cells is called Langerhans cells. The Langerhans cells are grooved or coffee bean-shaped nuclei with abundant cytoplasm. You also find eosinophils, smaller cells with bilobed nuclei and eosinophilic cytoplasm, pink. The eosinophils may be found in large numbers. You also may find Berbic granules under electron microscopy, which is tennis racket-shaped structure inside the Langerhans cells. The Ewings will have round blue nuclei. The Osteomyelitis will have mixed inflammatory cells. Treatment. The condition is self-limited, usually managed conservatively. The spine lesions usually resolve spontaneously. Bracing may prevent progressive deformity of the spine and correct the deformity in the majority of cases. Vertebral lesions usually regain about 50% of its height back. So if the patient have no neurological deficit, then follow the lesion and treat it non-operatively. 10% of the patients with spine lesion may need surgery for deformity correction or to relieve severe neurologic deficit. Low-dose radiation, about 500 to 900 rads, may be indicated if there is neurological deficit, especially if surgical decompression of the lesion is not possible. Thank you very much. I hope that was helpful.